let me address this from the point of physiotherapists. And the knowledge I've gained along working with them. One thing is, most of the cases that come here are basically something that affects your muscle and your skeleton. I usually have, it's a mouthful, musculoskeletal. Yeah, it's usually one of the biggest things that's affected. Now, when you've messed your muscles or your spine, the skeleton part, even though it's treated, yeah, it will never go back to being 100%. Yeah, there's that thing that everybody says bodies don't have spare parts, and that's true. You can't replace some of these skeletal issues. So that damage needs to keep on being followed up to ensure it never re-triggers. Yeah, sometimes you find there's wear and tear, natural wear and tear of the body. Yeah, so before you end up putting it into surgical cases, because you need to delay the surgical of the musculoskeletal framework until the last minute, then that follow-up needs to continue happening. And 90% of the time, it does not require you to come to the clinic. It requires us to come to where you are, yeah, and see whether you're functioning right, whether your body is still within the right framework, yeah. And I've seen a lot of this, especially with postnatal women who've had surgery and have sciatica, the follow-up of that skeletal. So it's necessary for that. And it also helps you function right, so you don't re-trigger the injury. Like somebody will be coming here, they're in sports shoes, yeah, or they're in orthopedics and ortho kits. But when they leave us and they think they're cured, and they've been discharged from a pure treatment plan, they go back to wearing 6-inch heels, yeah, or they go back to sitting in the wrong posture while they're in the office or driving a car. And then that means a few months down the line, they're back to being active patients. So we insist, yeah, and we have this health talk with the patients a lot on why you should continue having a follow-up with your team, and just check in on your body and whether it's functioning right, so you don't become another active patient. Yeah, I'd rather this clinic was known for follow-ups than active repeat patients. Yeah. I have seen conversations that have been done between a physiotherapist and nutritionist and the main doctor on basically what do you need to do, yeah, and followed up by a professional with a proper setup so that you don't end up being our patient, yeah. A conversation that was there in September, and I think it will be coming back, is something that people do so commonly without thinking about, yeah. You go to a barber shop and you have a head massage and your neck is being turned left, right, center, and trying to explain to people that that's one of the most dangerous things that can happen to you, because there's something called a lock-in syndrome. Touch the wrong place and you're disabled for life. So even trying to get the people who do that to understand, it's not about the client's pleasure, it's about their safety and what you need, and also maybe trying to get them to learn. Yeah, that has become a very common issue, and that is just like one of the examples of the things we are trying to do in terms of ensuring you never become a patient. Yeah, even how you sit in an office or in a vehicle, if your vehicle is your, and it's a whole area of science called ergonomics. Yeah, we also have a team that works towards pain science management. Yeah. And the team that works around pain science management is because pain is not something you should get used to, and pain is not something that you should tolerate. Yeah, so there's a whole team that works around that, and there's a medical doctor who leads that team. Thereby, most of the injuries can happen that require our services. So there's a whole team of trained professionals who are basically in sports science management. Here in Tibabu, we have a team that can do everything that is sports science, yeah, the full technical bench in sports. But at my level, I come in the management of the team we put out in the field for either individual sports or team sports. So normally in a sport, the coach is head of that technical team and reports to a team manager. So ours is to manage the coach and ensure that the coach has everything they require to work with a team or an individual at fitness level, which then we get the data and calibrate for the coach to have advice for their client, or if it's a team, to ensure they are fit, they are cohesive. So we basically run that for teams and individuals. So what we do at our at the clinic level, we have someone who steps in when we have a team under our care, somebody who steps in to ensure the coach is doing the right thing, is training the team well. They have proper warm-ups, warm-downs, they have good core management so that you don't end up with injuries. The technical team is well formulated, right from the technical under coaches and the physiotherapists or nurses or the medical team. So we manage that on behalf of sports institutions, other institutions that have sports as part of their staff wellness. We also do individual, like somebody who can be in competitive swimming and they need a coach, and then we'll supervise that coach. Yeah. So essentially you have an expert behind the scenes ensuring that the right thing is being done. So you don't have like bad postures, bad muscle development, wear and tear of the muscles. Yeah, like you find in a lot of sports, if not well handled, tendons are one of the things that ends people in a clinic for care. So we do that for organizations that have sports as part of their fitness. We also hold health talks for them so that the whole team and the other supporting members can understand what is needed for that to continue. Yeah. Yes, we do that, especially if it's part of our contract, yeah, because you can have very different types of contracts. We can have a contract that simply says we do sports coach management, so we manage for you the coach. We can have a full sports coach management and athlete or player or sports person management, and that one is actually one of the best multiple contracts that you can get, because then you ensure that the goals for the athlete or sportsman are being handled properly, safely, within the right timelines. Their nutrition is right, their fitness is right, the coach, the mental space, yeah, you bring in everyone that needs. So you sit down and you have key performance indexes for this, and then the reports come in and then we review them as per the needs, yeah, because at the end of the day will be a properly fit sports person who also has the right mental space to take the pressure, and a coach who understands how far they can push and what strategies to put down. Yeah, and for us, we only work with sports federation registered coaches. Yeah, so let's say if you're in tennis, the tennis association and the federation has you licensed, you're continuing with your continuous professional development. So we only do level 3 to level 1 coaches depending on what it is. Amateur coaches, unless you come in under supervision, you're never let to run a team or a sports person until you have been cleared by your federation and association to do that. Yeah. Some sports really know what to do. Yeah, some organizations think it's a secondary thing, so they don't really put the effort behind it. So they will say, yes, we have hired a company to do this, but they don't give the right information or support for that to happen. What I'll say is that sports coaching management is improving. We even now have sports lawyers and advocates who are qualified in sports management. Yeah. That means then that the fraud that we used to see in sports talent hunting is coming to an end once the athletes learn the legality of where they need to do. The only thing I have found it needs to either get addressed or move is the fact that we still have biases against female sports persons. Yeah, questions of so what happens when they're pregnant? Are we going to earn or not earn? Yeah. So those are things that need to be addressed because the necessary accommodations need to be in place. But sports management in Kenya is growing into its own. It's getting more professional. It's getting very data analytical based. And also it's getting to a point whereby you find that the coaches who are coming on board are getting very professional but it requires that the team owners and the sports people to understand the role of the sports management team, yes, when they get there, especially when it comes to, because the first thing you want to do is get good performance and hopefully zero injuries that would spoil the sportsman's life. Yeah. So I'm going to start with the major service, which is physiotherapy. And physiotherapy has a lot of areas, from skeletal issues to muscle issues to genetic issues that would come up. Then that would be our biggest clinical service. Then we have occupational therapy. We uniquely target for clinic children with cerebral palsy and spina bifida, because that can be handled within the clinic. But then for occupational therapy, we send for kids with autism, ADHD and the rest. We prefer to do either school or home-based, simply because those are not things that you can attend. They don't need a gym or a therapy room. What they need is to function in society and their school. So it's easier to do the therapy in the environment that they mostly spend their time in, which is either school or home. And we have therapists who can be sent based on the requests of the client's parents, and we do that. We have dermatology, ENT, and dental, which happen on clinic base, but we don't do pediatric dental at the moment. Yeah, we refer. We have a partner we refer to for that particular issue. We also ENT is both pediatric and adult, seen here at Tibabu Health in Dereshe Tower, second floor. We have consultants, doctors coming in. We also have consultants, medical officers, for when somebody comes in here, maybe for a simple rehabilitation service, and we realize that based on the radiology reports you've come in with, we need a medical review, and we have medical consultants for that. And they come in and basically review that. If we can't handle that case as an outpatient, then we refer it to the hospitals that are on our partnership network or the one that the client can afford. For speech and language therapy, which is one of our youngest, we are basically doing home-based and school-based. So we send the speech therapists to your home, or we refer to one of our partners. If we see our therapist cannot handle, what we do is when we refer you to one of our partners, and then the partner will handle you either as our client or we completely refer you out to them. We've recently realized that we need to do intervention plans, both for therapy and education, because those two never go apart for children. And therefore, we have a consultant who sits with me and the client family, and we work through that. And it's very dynamic. It's not a one-off thing. So it's dynamic in terms of if a child is in school for a term, we'll have 3 or 4 of those within the term. As they progress, we update. And the only one that happens on premises at the clinic is the first initial meeting. The rest happen within the child's school and the child support network. There's a very, very big difference, because home services are at your comfort, and some of them are basically because the patient is immobile. Yeah, you know what our road networks look like, you know how we don't have disability support on transport. So instead of maybe having some of those patients brought in on an ambulance, taking too many of the family members to bring them here, it's easier to move maybe a team of 2 therapists or a team of 1 doctor and a therapist to your home care service. And then it's offered in an area where we try to rehabilitate you to work. Like, let me give an example. Rehabilitating a stroke patient. Yeah. What we need for this stroke patient is for them to start functioning, feed themselves, walk around, bathe themselves. If they have to come to the clinic, even if we have a simulation room to rehabilitate you to learn to bathe yourself, it's easier for us to work with, for our therapists to work with your personal bathroom, adapt it to the case. So for home services, they are actually in the long run cheaper for the caregivers and the family. Okay, that's a tight one. So what happens is, if you come in here and you're a referral, yeah, your history matters. So the medical doctor attached who's here and deals with whatever area of services you need will go through your referral documents and imaging with you. They'll take a proper history. Then they will do a proper analysis of the patient. At this point, they will take them to the treatment room and do all the work that needs. Then they'll have a conversation with the patient if the patient is cognitive. If the patient is not cognitive enough to make a decision, then their caregiver will be brought into that conversation. And sometimes the whole family is brought into that conversation. And then based on that, then you have a treatment plan and a care plan. Yeah, sometimes it even involves a nutritionist. Yeah, especially for the elderly parents who are basically our parents right now. You find that maybe somebody has high blood pressure, has diabetes, has cancer. So you have to involve the whole family and the necessary panels of that. And then you come up with a treatment plan that's going to be affected by the multiple doctors and therapists, and two, a care plan that involves the family and how much, and the caregivers and how much they'll have to do. So that conversation is hard so that everybody understands where they need to be. I only come into this conversation if there's something unique that has to be provided for this process to go on, yeah? In terms of systems, in terms of administration, in terms of care management. That's the only time I'll come in. But the patient handling will be done by the clinical department. Yes. What I'll say about Tibabu, by the way, I'm a non-medic, is that there's consistency, there's follow-up. The fact that you've been treated and you feel you're fine doesn't mean you are okay. They will do a follow-up to ensure that you don't re-trigger what happened. If this was a work-based environment injury or trigger, then they'll work with you and even sometimes the companies to make sure that whatever caused this doesn't happen again. If it's genetic, then there's continued follow-up and management. Then the other thing we do for some of those cases is we have follow-up notes with your doctors. Yeah, how far we are, because we work with a patient based on a doctor's recommendation. So we also have to give back that feedback for the doctor to know whether there's need to change a plan, add to the plan, or de-escalate the plan. So that happens. But one thing about Tibabu is a specialist in physiotherapy is that even though you've left the doors of the clinic and you're not a daily regular patient, there'll be somebody who will follow up with you. It may be every 3 weeks, then down to 6 weeks, then down to 6 months. And we ensure that you don't re-injure yourself and become an active patient again. That has been our biggest. We also work with a team from the sports end, who then design for you a fitness plan, which is remote accessed. All you need is a smartphone or a smartwatch, and there will be an expert on this side of the system to look at it. Currently, the system is called Physiotherapy, and it offers both physiotherapy and occupational therapy, muscle manipulations and motor skills for you to keep fit and it's tailored towards each and every patient we've seen and client. And some people are not patients, but they need to avoid ever becoming patients. So they work with the Physiotherapy and an expert from Tibabu Health following up on what they need. Yeah. First and foremost, we are a purely outpatient clinic. Therefore, it has to, for our services, they have to be on your outpatient panel. So if you're coming to us, the first thing you need to find out is whether we are paneled. Yeah. If we are not paneled, then find out whether your pre-authorization allows you to come to our clinic. If need be, and then that we have to see you from a different facility or from home, we also need the paperwork pre-authorized, because this determines how far our services can go on the insurance, and also what services your insurance allows you to access within the rehabilitation and habilitation dockets. Yes. So when you're referred to us, the easiest thing would be for the patient to call our office line. Yeah, the receptionist is very well versed with insurance handling. So once you mention your insurance, she'll tell you even what is your limitations, what are the things on that insurance cover, and based on what your referral letter or if you are working without referral, what services you need. Then if we don't have you paneled, we will direct you to your insurance customer engagement department. They will either send us an email allowing us to handle you, or they'll send you with a pre-signed, pre-authorized form with all the limits and procedures in place. Yeah, and then once you're treated, it's up to us to liaise with the insurance for payment to us based on the terms of contract we have with them or the terms of that pre-authorization. But as long as you have your insurance cover and you need rehabilitation and rehabilitation services, be they physiotherapy, occupational therapy, speech and language, home care, hostel-based care, and among all the others. And when it comes to physiotherapy, there's a whole big area. If they are ENT services, the same thing. If they're dental or dermatological, the same thing. We have ways that we work with the insurance company that is supposed to make it seamless for the patient. For you, the patient, as long as the documents are right, all we need to do is leave it to us to handle it with the insurance. Yes. So I'm going to answer this from the point of the care we provide. You having an insurance cover means that you're not going to go bankrupt or pay out of pocket. Sometimes you don't have that cash to actually pay. And the misconception that people have is that habilitation and rehabilitation services are cheap. They're not. They're actually one of the most expensive areas at the same levels as surgical. So having an insurance cover means that you can access your services, because most rehabilitation and rehabilitation services that you need mean you're already incapacitated because of pain and your skeletal issues. So when you have an insurance cover and you follow either of the two procedures, you walk in and we are paneled, or you come in with a pre-authorization, then you get your services immediately. Yeah, and considering that we are even open on Sundays, all you need to do is call. You don't have to stay with your skeletal pains, incapacitated because of pain. Yeah. Well, challenges will always be there. So all you do is you have a proper rapport and communication. Sometimes they are late, sometimes they are early. As an insurance user and a service provider for people who have insurance, what we ask is we get paid at least within 30, latest 60 days, because we also have suppliers to pay, employees to pay, services to offer. Yes, those challenges are there, and they're there in every industry, the credit control systems. So for us, we've had challenges, but not the kind that would put us in a dilapidation point. And what we do when that happens is we have open line of communication with the most private insurances that we accept here. We take a lot of them. We take a lot of them. So starting up at the very top would be Minet Insurance. There will be GA, there will be MOA, there's KCB. That's an awesome client to actually work with. We have, I think we have the equity for employees, not for equity. We have about 40 insurances that we take. Yeah. So what I'll do with you is I'd probably give you a brochure that has that, and you can just add them. And they keep growing. We keep getting new panels. I mean, it's a growing industry, so we keep based on patients' requisitions. Because sometimes it's actually a patient who came for services, paid cash once or twice, who then writes to the insurance. Instead of you keeping on refunding me and making claims, could you please panel this provider? And that's how we grow.